Good morning. My name is Jeremy Summer. This is my health assessment video part 2. Again, I didn't have a patient, so I'm going to demonstrate on myself and describe some stuff. I did talk to a patient the other day. She was a 42-year-old woman, 25-year, 1-pack per day smoker. She has no medical problems herself, but she does have a family history of breast cancer and bladder cancer. She has heart disease in the family. She goes to the doctor about every 2 to 3 years, but she only goes when has any issues. I asked her about pain. She did say that she has bilateral knee pain. I asked her to describe them using the cold spa method, which is character, which she described the symptoms. She just kind of said was dull, achy, onset. When did it start? Well, she doesn't know. She knows if she's always had it. Location, so it's her knees. Duration, how long does it last? She says it's constant. Pattern, she said, or severity, how bad is it on a scale of 1 to 10, or 0 to 10? She said it's about a 3. Pattern, what makes it better or worse? So for pattern, she's says that nothing makes it better or worse. She just always has it. And for associated factors, there's no other factors that are associated with it. So for musculoskeletal, first things first, I'm going to kind of check to make sure that everything is symmetric. So if I check, going to have somebody bend over, check their lower spine, just kind of make sure that it's symmetric on both sides, that they can move their hips and they have one solid motion. Same thing with the other joints. They're going to shoulders, neck, elbows, all that, just kind of do range of motion with everything, move their hands, feet. And while I'm doing that, I just kind of want to make sure that I am putting my hands over, kind of feeling the contour, making sure there's no abnormalities anywhere, bumps or anything like that. And then next I'm going to look at the thoracic cage, which is the area that covers the heart and the lungs. I just want to make sure that everything is symmetric there. When I was looking at the lower back, I also kind of want to look at the spine, just make sure that both the spine and the thoracic cage are symmetric. Again, there's no bumps, bruises, anything like that. So if I look at the ribs, I want them to be a 45-degree angle relative to the sternum, to the thoracic. I'm going to check tactile fremitus. So for tactile fremitus, I have a monkey here that I'm going to demonstrate on. So I'm going to put the palm of my hand kind of underneath, right at the shoulder blade there, and I'm going to have them say 99. And what I want to do is I want to check for the vibration to see if it's equal. So I'm going to do left side 99, right side 99, then I'm going to go down a little bit. 99, 99, 99, 99, just to make sure that I can hear a vibration that's equal on every time that I have them say 99. So for percussion, I'm going to kind of do the same thing. I'm going to tap, but what I want to do is I'm going to tap starting at the top, and I just kind of want to tap to make sure that I can feel a kind of a low, hollow sound against my fingers as I'm tapping. And I want to do a side-by-side comparison for that again. When I listen to the lungs, I just kind of want to make sure that I don't hear any crackles, which is popping, wheezing, which is a continuous musical sound that's basically on expiration, or stridor, which is a musical sound on inspiration. That should be a single pitch. I'm just going to kind of look to make sure that somebody has symmetric when they're breathing, that their chest expansion is symmetric. Have them take a couple of deep breaths. Okay, so I want to feel for the apical impulse, which the apical impulse is usually between the 4th and 5th intercostal space, which are the spaces between the ribs. So for me, that's almost about my nipple line there. And then I want to listen to, I should hear lub dub, which is the valves closing. That's what the normal sounds for the heart are. So I'm going to listen to the aortic, which is the 2nd intercostal, so that's up here. And that's at the right side, kind of midline there. And then the pulmonic is kind of across the same, across from the aortic. There at the 2nd intercostal. Erb's point is kind of right in the middle. And that's again mid-clavicular, the tricuspid and the mitral. So the tricuspid is the 5th intercostal, so that's kind of right down here again. That's along the sternal border, and then the mitral is mid-clavicular on the other side. So I'm going to look at the abdomen, the contour of the abdomen. So I just basically want to make sure that everything, that it should be flat or rounded. The abdominal area there. If I check for bowel sounds, so bowel sounds, there's 4 quadrants, and I'm either going to say that it's hypoactive, which means that it's I don't hear as many, or that it's hyperactive. So I want to hear a high-pitched gurgling 5 to 30 per minute. So if it's hypo, I'm going to hear less than that. If it's hyper, I'm going to hear more than that. But there's 4 quadrants, so I'm going to start left upper quadrant, then right upper quadrant, then right lower quadrant, then left lower quadrant. And then I also want to listen to the heart sounds, or the arterial, the peripheral artery sounds, kind of. So I'm going to hear the aorta, the renal biliary, the iliac biliary, and the femoral, femoral, sorry, I can't say that word, biliary. So for those, I'm going to kind of the aorta is midline underneath the sternum. So what I don't want to hear anything is the thing. I'm going to kind of just listen to make sure there's no sounds. I shouldn't hear a bruit in there. Bruit means that there's a whooshing sound, and that means that that there could be a problem if there's a bruit in there. So the aorta, so that's kind of midline again, right underneath the sternum. The renal are kind of left and right to the aorta. The iliac, so that's left and right of the umbilicus, which is right here. My umbilicus is right here, so it's going to be kind of there. And then my femoral, so that's kind of at my waistline. Right around my pubic bone there. So I'm going to check for pulses. So my pulses are going to be my brachial, which are in my elbows. I'm going to check those bilaterally. I'm going to check my radial, which is my thumb side. And I'm going to check those bilaterally. My ulnar pulses, which is on my pinky side of my hand, I'm going to check those bilaterally as well. And then I'm going to check my pulses going down. So my femoral pulses are going to be on both sides of the groin there, in the groin area. I'm going to check those. The popliteal is on the inside of the knee. I want to make sure that I can feel those. And when I'm feeling for these, it's going to be either 0, which means none, no pulse, 1, +1, +2, or +3. So normal is +2, so I'm feeling +2 for all of these. Then I'm going to move down to my feet, so my my posterior tibial is on the inside, kind of underneath the joint there. I'm going to check that on both sides, make sure I can feel those sometimes. You just kind of, you'll feel those eventually. And then the last one is the dorsalis pedis, which is you're going to use a light touch, but it's kind of parallel to lateral and parallel to the big toe. So right around there, those ones are kind of hard to feel. So then I'm going to demonstrate an Allen test. So an Allen test, what I'm going to do is I'm going to put pressure on both the radial and the ulnar pulses. Okay? I'm going to ask my patient to make a fist, and I'm just going to have them make a fist and kind of hold it. And then I'm going to have them open their hand, and when they open their hand, I'm going to depress on the ulnar side, and I want to see the palmar blushing to see how quickly blood rushes back to the hand, if blood rushes back, so we want that to be between 2 and 5 seconds. That's what the normal blushing is. I'm also going to check cap refill, which again, I said that in the last video, but that you're just going to kind of depress on your nail beds, and you want to see how long it takes for blood to come back. Cap refill, normal is less than 2 seconds. Talk a little bit about cranial nerves. So cranial nerve, there are 12 cranial nerves. Cranial nerve 1 is olfactory, which is a sense of smell. So get something, have them smell. Have them smell something, like occlude one nostril and see if they can smell it bilaterally. We did optic nerve, which is cranial nerve 2. We did that one last time, but that's where you shine the light in there and you want to do the near vision confirmation or confrontation tests and everything. In the last video, I also did 3, the ocular motor, 4, which is the trochlear, and 6, which is the abducens. So that's the sensory functions of the eye. That's where, when I get perla, I want to make sure that those are working properly. The trigeminal, which is number 5, that's the motor and sensory. So I'm gonna clench the teeth, and I'm gonna pull the jaw apart, and the whole point is when my patient clenches their teeth, I don't want to be able to pull apart their jaw. And then I'm gonna kind of touch their forehead with a cotton swab, and then I'm going to touch their chin, and I'm going to touch their cheek and their chin on both sides, and I want to make sure that they can feel it, and as soon as they feel it, I'm going to have them say now. So number 7 is the facial nerve. So for the facial nerve, that's a motor, so then I'm going to have them smile, frown, close eyes tightly. When they do that, I'm going to try to open the eyes and see if I can open the eyes. I shouldn't be able to. I'm going to have them show their teeth, and they're going to puff out their cheeks. And when they puff out their cheeks, I'm going to see if they have normal air expansion, that it expands equally on both sides. For the acoustic, that's just normal hearing. So that was when I do the whisper test. When I did the whisper test last time, I want to make sure that, you know, they can still hear and everything. And they can hear bilaterally, so I'll whisper on one side and have them repeat the words, and then I'll whisper on the other side and have them repeat the words. Glossopharyngeal is nerve 9, vagus is nerve 10. So for those, they're both motor nerves. So what I want to do is I want to have a tongue blade open up and have them say uh-huh. And when they do that, I'm going to look to make sure that the uvula and the soft palate rise midline. And then also, I'm going to, with that tongue blade, I'm going to take that and put that against the postpharyngeal wall. And that's to test the gag reflex. Cranial nerve 11 is a spinal accessory, so that's where I'm going to have them rotate the head, and I'm going to push and try to have them press against my hand to see if they can, see, you know, if they can move my hand. Same with the shoulders. If they can't move my shoulders, the whole point is I'm going to press down as they're pressing up, and they shouldn't be able to move my shoulders. And 12, hypoglossal, so that's the tongue again. I'm going to have them stick their tongue out, and I just kind of want to make sure that it's midline. And I'm going to have them say light, tight, dynamite, just to see if they have clear speech. Lastly, if I go back to my patient for health promotion, when I was talking with her, I basically told her, I said, okay, so you need to go to the doctor. Going to the doctor annually. Because you're over the age of 40, you should have your mammogram, and for goodness sake, stop smoking.